We're back. Strength and knowledge is back. I'm John Allan, and in this episode, Dr. Hector Wang and I discuss all things combat sports. Specifically, we dive into the complexity of combat sports, the importance of fatigue resistance in rehab, and how to apply the StARRT framework to difficult conversations with athletes. Without further ado, let's get into it. Dr. Hector Wang, aka Muay Thai Physio, where physics meets performance. Welcome to the podcast. If the viewers look through your Instagram, which I highly recommend they do, people will see how detail oriented you are when it comes to translating physics to performance, especially in combat sports. For the viewers who are unfamiliar, give us a brief introduction into where your passion comes from and how to apply your knowledge to your patients and clients.
Hey, dude, it's so good to be on here. My name is Hector. Um, I've been I've been training combat sports athletes, specifically Muay Thai fighters, because that's very, very close to my heart. I've been treating fighters probably since I was in PT school, and it just kind of the passion just kind of stay until after. I've been doing quite a little bit of online education through just short form social media like Instagram and TikTok, but hopefully I start doing a little bit more long form. It's been really fun at just educating people and trying to bridge the gap of scientific principles as well as the actual applicable things we see in combat sports and in fighting. Yeah, I just moved to San Diego and it's trying to build a in-person clinic down here, and so far everything's going super well.
Awesome. Thanks for the introduction. Let's get right into it. So, I think our first talking point we want to get into is kind of what differentiates combat sports from other sports to you. I know you talked a little bit about the passion of for Muay Thai, but let's just kind of dive into like the complexity of what combat sports kind of requires from an athlete, but also from like the rehab perspective as well.
Yeah, I think I always like to think about combat sports. Number one is it's a big umbrella term. It include variety of different sports, different striking arts, grappling arts with just vast majority demands. Um, End of the day, we're talking about competitive sports. So I think one thing that doesn't change from combat sport to field sport to court sport is that the competitive nature and the fact that we value winning, or most people should they value winning more than in some way physical health, right? Like there's a very subtle dynamic there. So I think in that nature, it's the same. What really makes combat sport different, I think, has to be the mentality of the fighters, of the athletes. They are so used to pain, and they have just a fundamental different relationship with pain, I think, compared to other sports athletes, because the doesn't matter which combat sport you are doing, the whole objective is to inflict pain on your opponent so that they quote unquote give up. And I think sometimes when my job as a rehab professional kind of goes into that, you can kind of run into a little bit of a speed bump, because as there often I have a conversation with another fighter in regarding to should they fight, should they be training. The fighter side of me is kind of agree with them, is that okay, the fighter side of me think they should push through, but the PT side of me think they should pull back. And there's always a little bit of dynamic and quite a bit of decision making that needs to happen at such an individual level, regarding not just injury, but where the person is in their fighting career, where the person is in their, quote unquote season. Um, and to make those things, and that decision making is probably the most fun for me.
When you're making a decision for like maybe any other sport, like more field sport, court sport, I feel like the risk is always based on the individual. And what I mean by that is like it's their kind of like their re-injury that's the only thing that's really holding them back is like that field sport, that court sport, whatever, that challenge is putting them at risk. But then you add the combat sports where there's an also added factor, like you said, like the goal is to inflict pain. So not only are what the performance side of the athlete is risky, but then also you add that like mentality from the opposite fighter, and that just definitely plays a huge role into like the education, the complexity of that decision. So that's awesome. Something that kind of came to mind is like pain neuroscience. Do you find yourself educating, spending more time with your combat athletes on like kind of the neuroscience of pain, or is it just kind of just something that you know that mentality is the mentality and you just kind of got to treat them as they are?
Yeah, it's so I don't particularly go into, the mechanism behind pain or the neuroscience part of it, but the way I think about it is that they live in their bodies. They know pain from, training, pain from getting hit, getting pinned, and there's part of like pain from injury. And often I try to spend time to educate what is quote unquote an okay pain and what is the pain we need to pull back from. And a lot of education is trying to get them to understand not all discomfort are created equal, because it's such a mentality to shove all pain in the back of their head. But when it comes to, reintegrate back to training when someone's coming off like a bad injury or surgery, we obviously want to monitor if our training load is, too much, too little. And a lot of times it's more educating the nature of pain. Like, you know, does it cause stiffness? Does it actually affect the joint range of motion? Is it actually lingering? What are some different characteristic between, the quote unquote a joint pain that we don't want to stretch out versus what is quote unquote normal just from training and practicing. Um, it's definitely a learning curve, no matter like how experienced a fighter is. I find the first couple of times it's always going to be a little bit newer concept to talk about what is a, okay pain, what is not.
Yeah, I'm just curious, what's like your average age of those clients that you're kind of training versus rehabbing as well? Like where would you say most of the like the age ranges?
So for fighters, as young as 15-year-olds, competitive, semi-competitive fighter, to as old as like who are still like really competitive, really eager to train, probably up to like 50. And I've also like a good amount of like martial artists, who people who are interested in martial arts who don't necessarily want to compete in fighting. Like that can range all the way up to like 70, 80 years old. And that's pretty fascinating. Like people are like still really getting after it at those age. But like I'll say like the middle of the bell curve is probably somewhere between 20 to 35. Yeah.
Yeah, I think that answer kind of really hammers home the point that I was trying to make is, and we were trying to make as about the complexity. It's just like there's so many different factors that go into to combat sports as a whole. Like you said, different demands of each unique combat sports age, training age, as well as just the mentality of like I'm going out there to inflict pain, and I know I might be at risk for more pain. So I think like I just wanted you to kind of clarify and really hammer home that point of the true complexity of combat sports. We're going to transition right into some of the unique demands of combat sports, and we're going to go dive right into like what changes when an athlete is truly in a training camp phase for a competition. How do you kind of manage the demands of rehab, and how where do you fit into that continuum of the interprofessional training?
So we're talking about if someone is training, but they also have an active injury that's going on.
Correct. Yep.
Huh.
They're in pain. They're coming to see you, but they're also have a end goal of a certain competition.
Yeah, I think it's often a bit of a layered approach. I try to start from the ground up, right? I kind of know what the end goal is. The end goal is to, compete, whatever that looks like or means to them. But often the first layer I'm always trying to establish is their current training actively making them worse, actively like worsening the injury, right? Are they just having flare up after injury, but get back to baseline session after session, like being a status quo, or is this week actively worse than last week? If they're status quo, I feel good about kind of proceeding with my business. If they're not, then it depends on who are the stockholders involved, whether there's a head coach for their, you know, prospective sport, and sometimes there is also a strength conditioning coach. Sometimes there's not, but it's really just to talk with the coaches, understand what are demands that are placed on the quote unquote injured joint or injured body part, and how can we pull that back so that at least we can maintain a status quo in their training so that they're not making anything worse. That give me room to actually add more things to provide a rehabbing, a healing stimulus. And often, if someone's actively in camp, especially if they have a fight in mind, the approach I'm often trying to take is starting with a minimum effective dosage. Sometimes often just look like 1 to 2 exercise, 2, 3 times a week for the first week, just to kind of see if we can make some progress, if we can reduce the irritability at certain activities, at certain positions. And from there, once we can establish that, I tend to go fairly high frequency. Yeah, frequency is the right word. I tend to go fairly high frequency, depends on like how bad they want a competition. Because the way I look at it is that there is there is often, we kind of know for rehab to happen, you need a stimulus and need recovery. But how much a stimulus they can tolerate and how long a recovery that they need to be able to tolerate that stimulus again, that's all dependent on individual factors. And my first week is often trying to play with the safest approach and trying to see, okay, can they at least tolerate some level of stimulus and get some data on how many days they need in between? Are they getting sores that affecting their training? Are we making progress in just a week or 2 week? And from there, really trying to put them through, with the data I'm getting back from those recovery and from the irritability, and my best educated guess, what is a maximum tolerated dosage they can get from a specific rehab exercise? It doesn't really contribute to, total fatigue that will add on to the already like full camp. I don't know if that answered the question. I feel I answered kind of abstractly.
Yeah, no, that answered what I was looking for. I think you hit it on the head. That last point there is like we know fatigue resistance is one of those like biggest buckets for competition, right? Endurance is a crazy thing for any combat sport. And I'll just kind of follow up question was like, how much are you doing like active fatigue resistance in your like sessions? Or are you relying primarily on like the head coach and strength and conditioning coach to kind of build that fatigue resistance, build that engine for competition?
Truthfully, it kind of depends. The way I think about it is that, the way rehab works is that there's no certain standard I have that I say if you pass this, you're 100% okay. But they're just a continuum standard that will continue to rule things out, right? Like if someone say hurt the shoulder and that couldn't even move the shoulder, will obviously need to be able to move the shoulder. Then we'll obviously need them to move with shoulder with a lot of force involved. Then we obviously need to move the shoulder with a lot of velocity involved. And the last step to me is that, okay, now we need to move your shoulder with a lot of velocity involved, but also at the same time in a repeated nature. Like fatigue resistance, such a last stage type of deal where there oftentimes, many times I couldn't even get even close to that. And they still want to compete, then we just, inform them the risks of competing, the possible outcomes, and just kind of roll with it. But if I have a lot of time, if I have all the time in the world, if there's no competition in mind, they just want to take care of this thing as full as they can, then I want to be the person who's doing quote unquote quality control, right? I want to make sure this structure that I rehab, whether it's a rotator cuff tendon, right, Achilles, MCL, whatever you want to name it, I want to make sure at least under my control, it can tolerate a lot of stress and on the very high velocity in like very vulnerable positions, and sometimes in repeated bouts, and they still feel okay. If they get there, then obviously they're fine with sports, but they're fine with like back to training and competition. But the way I picture these things often like just kind of see how many step we can go up, and there are times we just never end up being on that top step, and that's okay. And there are times where plenty of times where then I like to control everything.
I'm sure your experience with fighting helps a lot with that end stage. I feel like that's a unique skill of yours and a unique skill of people that have done combat sports to really understand how much repetitive nature that is required in fighting. And you mentioned like the Achilles, and like people probably don't even think too much about like how much load goes through the Achilles, every single kick, every single step, every single punch. But I would imagine you see probably a lot of Achilles tendinopathies in your field. So yeah, I think it's very important for the repetitive nature, very important for people to understand how demanding that sport is. And obviously, the best rehab has to match that demand. Again, this transitions nicely into the end stage, like we were kind of just talking about, is like I know you said you don't have any like true great tests to test like true priorities and true readiness for a return to sport, but like kind of what's your thought process of like, hey, this person is good to be discharged from my plan of care. Like, what exactly are you looking at? And I'll leave this up general, but if you want to take it to more of like a specific joint, you're free to go.
Yeah, I tend to think about this. I think about what I think, especially as we get to the end point, and I define end point very differently. I think a lot of times when people are no longer having pain in their day-to-day training or day-to-day activities, oftentimes they're probably not really close to the end point, right? There is when we talk about end point, we're talking about like a maximum able to tolerate like a very 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 high bout of like force and velocity, and those are type of things that very rarely we experience in just day-to-day training, or at least you hope they don't experience in day-to-day training. But but often for people to get back to pain free to their training, in my head they're like, okay, we're maybe 70 to 90% done. But what really is going to make for me to make that decision, make me to write a perfect scorecard, is something that's a lot more, I think, unspecific to fighting, but more specific to the structure itself. What I mean by that is, when I'm thinking about um, what's a good example? Like a rotator cuff tendon, right? Like for let's say internal rotators, right? For subscaps or for long-headed bicep tendon, it doesn't matter if this guy is a Muay Thai fighter, a volleyball player, or a wrestler. We know the vulnerable position for subscap tendon is at the end range of external rotation where my arm is 90-90, the super vulnerable position. And for me, this position in itself might not be really fight specific or sport specific, but to a injury subscap, that's an injury specific position. The ability to still produce force or ability to resist really high velocity at that quote unquote very vulnerable position, to me, is the gold standard of subscap tendon injury rehab. And that's kind of cross different sport. Maybe you'll have like tiny bit variation talking about volleyball versus wrestling, but when I'm trying to decide if I'm good to discharge, then often what I'm trying to do is really trying to find or design sometimes a test or a activity, a position that put not only a lot of load but also sometimes very high velocity at a very very tough position of the certain joint and of the certain body part. The subscap's a good example. Another good example sometimes is like a good amount of meniscus strain, good amount of MCL strain happened was fighting just because there's so much twisting motion in the knee. For those things, something that end stage, I really want to look at an activity that give them a tons of valgus force, right? Something like a Copenhagen where there's literally a whole body work, a body weight on that MCL, or something like a single like hop, but for from lateral to medial direction where each landing there is a high level of valgus force kind of going into the MCL. Typically, that's kind of where I make those decisions, trying to almost just make up tests and kind of see, in my mind, how I process it. Okay, ISO in an isolated fat manner, how can I almost trying to flare up this joint, this body part? And I'm gonna try to do that. And if I can actually flare them up, then my job is not done.
Yeah, that's also very easy to translate into a lot of clinics, as not everyone's privileged enough to have all this important technology that we have out, and like not every clinic has it, especially if you're starting out a clinic. Like it's yes, it's very, very nice to have those numbers, and obviously I rely on those numbers a lot and with end stage, but like if they can't, like you said, if they can't produce an isolated movement at end range, it's very likely that they will be back in for some other sort of injury due to like a non-negotiable compensation that they probably are experiencing with these more global return to testing stuff. So that's a great point that you make. Anything else you wanted to touch on that point?
Yeah, yeah, I guess sometimes when I think about these things, obviously it's good to have a dynamometer, to have a force plate, um, and and able to like actually have a objective number that we can put it on the paper and compare. But a lot of times, I feel like simply having a good understanding of what type of activity put what force through what structure, and have an understanding that MCL resists valgus force, right? That's kind of the big thing it does. How can we put a lot of valgus force in a safe manner and, without flaring them up, and that being a good a good, QC check for me to say, all right, they're done. They probably can go back to tolerate a the fighting or whatever the sport they get back at. But I think a big point I want to kind of hammer again, double click again, is really that the end stage test, if we're really talking about discharge, then the intensity of that test should in nature be a lot higher than anything they have to go through day to day. Because if they have a lot of times, this will be true that they don't have pain on their day-to-day stuff, they don't have pain on their day-to-day training, but you notice this major deficits that aside, then we know for a fact, number one, they probably running, like you said, some sort of compensation to avoid that. And number two is we know they probably liking movement strategy that really utilize that body parts. And that, you know, despite like without like too much research backing, we can, I feel pretty comfortable to assume that is something that not only affecting performance, but also future injury risk.
Thanks for doubling back on that. It definitely is important to differentiate that. And yeah, I think you made a great point of like pain is is definitely not the end stage, right? Pain
Yeah.
is a non-negotiable to get out in like maybe phase two, early phase one, or early phase two, late phase one. And that's just the beginning of the rehab. And that's to me, that's the beginning of the fun part, right? We all
Yeah.
know how to calm down the system. Now we get into more of like the functional, more demanding tasks. So I appreciate you hitting that home. Anything else you want to just kind of say to wrap up? I think we hit on some great stuff today. I think the audience will benefit a lot from hearing this conversation. But is there anything else, any of the questions we kind of talked about today that you want to double back on, or are we good to wrap it up?
Yeah, dude, there's like, I feel there's a level of decision making that kind of goes into it that can make me, I'm getting better on like being able to on both sides a little bit now. Is you ever heard of a StARRT framework? It's a return to sports framework on just basic decision making. Big part of it, I like, like return to sports, I spent a lot of time just kind of nerding this out. And a big part of what I learned that I've been using kind of every day is to like have the informed like consent with athletes on like it's not like sometimes like whether they can or cannot go back. It's how dire the consequences, right? Like if like going back have like a 50-50 chance of flare up, but flare up just meaning the knee will be swollen for like a day or two, that's something we can't take. I like even with like pretty high chance flare up, I was like, dude, try it out. But there are cases when you go, especially return to life stuff, there's like, 90-10%, there's like only 10% chance something bad happened. But if something bad happened, it's going to be something catastrophic. And it's like, I want to let you know that people are going to end up making decisions differently, even with the same information, same risk. But I find it just like, if I just make my point educating, it's like, it's like, what is a chance something actually goes south and what going south actually look like. Those two pieces of information get together, they typically would have a pretty good understanding. It's like, if I really don't want them to like go back, why is that? Or like, if they don't feel comfortable, sometimes I like do try it out, and why is that? I feel that's like an easy way that I can understand. Like I feel comfortable being a PT and being like a peer, and that people actually have pretty good understanding to it.
Yeah, it's a great framework. I think it definitely applies to a lot of places, especially sports, especially like you said, just return to lifestyle. I think it does a good job of really highlighting and making it pretty easy for the PT to follow and educate on like, hey, this is the worst case scenario if you did X, Y, and Z, and then
Yeah.
we'll uh we'll treat you treat you as is because at the end of the day, I'm not going to be there holding your hand. You're going to be the one making the decision, and that's the beauty of our field is we got to roll with the punches just like a combat athlete does.
Yeah. I know, it's probably a long day for you, just like this last thought in my head. Like I returned a volleyball player back to court on like 6 months with like a quad on a little bit over 2 Newton meter per kilogram. Like, in any book, right? You'll be like, don't do that.
Right.
Like that's not smart. But it's like, when you put in all the like the personal constraint, and you're like, okay, we're talking about like this, high school girl, senior year, not be able to play, super depressed, team captain. She's a setter and can like kind of set and kind of just pull back. And there's like so many things like consider. I was like, okay, there's actually a pretty solid case for me to make to say like if we play our cards right and really limit a couple things to do on court, like you can go back with like half a quad, and it's like safe for you, but I wouldn't recommend this to literally anyone else. And I feel like I just make a lot more of those decisions in fighting. Because in other sport, you tell them it's like no, they're like pretty good about no. In fighting, sometimes really like you make a like when it matters a lot for them. Like there's quite a little bit like a mental gymnastic of trying to make things happen.
Well, awesome, man.
Mm.
Thank you very much for your time. I think that was a great conversation.
All right, thank you so much. Thank you for reaching out. This is really fun.
Of course, man. Keep killing it.